Just close it and try to open it. If you have a very thin line that is there, it is Ama Pratishaya, and if it does not create that, that is a Pakva Pratishaya. Okay. Now, snot, this is the word that we use for the normal nasal discharge, that is liquid discharge, S-N-O-T, snot. So, if you see a normal snot, you can see that it is Vishada, that is clear and transparent, obviously. It is Alpa Pichila. All the snot does not, is not like you take it, you fall it immediately. There is something will stick on it, but it's Alpa Pichila. Okay. Moist, obviously it is moist. Moderately thin and consistent. That is what? This is the normal. So, all the doshas are there in a normal nasal mucus. Okay. And boogie, this is the word that we give for thick nasal mucus. You might have seen children taking out of the nose like this, making it into a round ball and just throwing it out. This is all you can see, especially if you want to see what is real diseases symptoms, you need to go to some bit interior of the villages. You will come to know, understand that what is disease, how it is manifested, and how people are looking at this. Because I had been working with many rural areas, we see these people. Some children even take like this and they like to eat it. That is why they get all kinds of malnutrition and diseases. Okay. It is a fact that I'm saying. Maybe it's like it's not good to hear, but these are some facts that is happening in India. Okay, so that is called as boogie. Now you can see this stage, that is clear water that is being dripped out from the nasal. Almost everyone might have at least encountered this at least once in their lifetime, right? That is clear water is coming out of the nose. So you have the water conditions. It can come in allergy. It can come in an early viral infection. It can come in an acute inflammation. Vada Pradhana Pittanubandha condition, that is what is there. It is a normal clear. If you see Tatra Vadat Pratishaya Mukas Shosho Brisham Shavagrano Paroda Nistoda Danda Shanga Shiro Vyataha Kitaka Eva Sarpanti Manyate Parito Bruvo Swara Sada Chirat Pakaha Shishira Acha Kabasruti. So Acha Kabasruti is coming under the Vata Pradhanatva. And there is one important point here, frothy in GERD. What is GERD? Gastroesophageal reflux disease. So once it is there is GERD, the water that is coming out from will be a frothy in nature. Why? There is Vimarga Gamana of the dosha Vata, that is from the stomach it is coming to the nose. There is Vimarga Gamana. So because of Vimarga Gamana there will be say frothing of the, okay, frothy in GERD. Now this is a bit more Ghana Shukla, that is Kava Pradhana, where you can see thick nasal mucus. I think the pictures in this is not getting clear. In the slide it is there, you will get it. Okay. So you have some more bit thick mucus, and when it is thick and white, so Kava Pradhana that was being told, thick and white, that is indicating that it's a chronic inflammation, what we call it as chronic rhinosinusitis. So it is thick and white. Okay. Kabhat kaso aruchir shwaso vamatur gatra gauravam madhuryam vadane kanduhu snigdha shukla kabasrudihi. So whenever there is kabha, it is white, kabha predominance. Okay. COPD, that is also, you can see many people coming and saying like they need to hawk out. They need to remove the kabha, white kabha, that is COPD. Okay. Now yellow mucus, you can see the yellow mucus. Okay, see, yellow mucus. You should be especially careful with children, because the moment mucus comes out from, they will eat it. Now I know because my daughter is right now on that stage. Last week she was there like that. The moment it was coming, they will eat it. So in children, you should be very careful with this. You should ask the mothers to always take care of the nose. Just wipe it out as soon as it comes. Okay. So yellow nasal mucus. So it indicates the presence of infection. So you have a WBC and the bacteria, dead bacteria, that is happening. Okay. Green nasal mucus. This is very important. The green nasal mucus. It indicates a severe infection. Now, if you see the Pakwa Lakshanas in our science, there has been told that a yellow tinge can happen. Okay, so mild amount of infection can also come under Pakwa Lakshanas. But a severe infection will not come under that. That is, it has been changed into green. And you can see that Puyopama Sleshma is told in Sannipata. So, whenever you have a green color, it gets into Sannipata stage. A brown nasal mucus. Have you seen this brown nasal mucus? It especially occurs when you have gone out and come and you ask the person to sneeze. The dirt and the smoke, whatever there is, it will get into brown sun. The tamra nibham, that is almost like a brown color. Okay, so tamra drava sleshma, it is a pitta pradhanatva. Now you have a red mucus, that is red mucus that is coming. The frank bleeding that is coming into that is what we call it as a serosanguinous discharge. Okay, so the Rakta Pradhanatva, that is Rakta Pradhana, or it can be even a Sannipata or even Dushta Pratishaya, though all this comes under the Rakta Pradhanatva. Now a grey nasal mucus, I have not seen till date a grey nasal mucus, but I have seen black nasal mucus, especially in fungal infections. You get black nasal mucus. Okay. Again, a bit we had in UG final year, our teachers were like, they put some cases of their own and they ask us to diagnose it. Okay. So one of the patient put the case of their own, they do something to the patient. Patient comes with a complaint, and then now you have to diagnose it what it is. So we had got a patient. The patient we asked them to sneeze. We saw that it was a black spot. So we told it is a Sannipata Pratishaya. The next moment teacher scolded like anything. Have you asked like what had happened to the patient? It's simple. The teacher gave her a Pradhamana Nasya Churna just to inhale it. The churna was there in the mucus. It came out. We call it as a Sannipata Pratishaya. So you should ask the patient before diagnosing it as a Sannipata Pratishaya. You should ask the patient like what was his nature, what he had done, all those things. Then you should come to a diagnosis of it. Okay. But a black mucus, don't forget that there can be fungus attack, or he may be a chronic cigarette inhaler. For cigarette inhalers also, smokers also, this can be done. Okay. And again it is an asita sleshma, puyopamam, asitam is all coming under the Sannipatatvam. Okay. So vata, there is no color. Pitta, there is tamravarnatva or pita. In kabha, there you have, it is totally white. And in Rakta Pratishaya, you have, it is totally red in color. And all other colors come under Dushta Pratishaya. Okay. Nasal crusting. So here there is Gradida Sleshma. Puyopamasita Rekta Gradida Sleshma Samsruti. There is Gradida Sleshma. Again it is a Sannipada Pradhana. So you can see that here there is a Pitta that is being come. If you see the Nasa, Shosha, this Lakshana that is being given by Susruta, Pittena Gadam Parishoshitecha. That is what he has told. When Pitta comes and if you have very Gada Parishosha, so that is what is happening here. So you can see the yellow color. When Pitta is there, there will be yellow color in that. So it is nasal crusting. That is Pitta Pradhana Sannipata. So I have just put some doshas here. Okay, I don't think you can identify this because this is entirely, can you see this? This is bit water more, kabha less. It is ama because it is coming as a very thin thing and it is getting in bulge, not flowing very easily. So there is ama in this. I don't think you can make out that. Last one is very, very watery. Okay. Can you make out this? I don't think. It's a bit yellowish color. Okay. You can see a bit brownish color, asitas leshma. Okay. You can see this is a very good ama lakshana. This is taken from an endoscopy where when you suck, it is forming in the form of a line. This is ama pratishaya. Ama and kabha is more. So this is a sama kabha. More ama and kabha is there. And you can see this last one. It is a pus that is coming out. Okay. So this is a Sannipata one. Okay. Now we will go with the diagnosis of the disease. This is that's what, it's a brain shaking event. See, if you see the nasal discharge that is especially happening at night, Visheshad Nishijayate, the nasasrava which is happening at night, it is nasasrava. The diagnosis is nasasrava. If there is serous discharge, there is loss of sensation of taste, excessive sneezing, it is Vata Pratishaya. Please don't write any of this thing. If at all any moment if you feel bored, please interrupt me. Okay, I'll just stop. If it is salt, thick, whitish discharge or yellowish discharge, again, especially at night, it is also called as nasasrava. So, nasasrava is that at night you will have more discharge. That is the most important point. Brahmshatu, which I told you earlier, that is after apinasa, there is Brahmshatu. There you have either on exposure to sunlight or on exposure to pitta tapta. So the person will always have an history of that. He has taken something after that, this has come. So it is Brahmshatu. And you can see the Kabaja Pradeshaya, I told you, I had given the chart of it. You can see that if there is itching in the Kantha, Talu area, that is all Kaba Pradhanatva. So it is a Kaba Pradeshaya. And in Pradeshaya, you should have always excessive discharge from the nose. Okay, so it is a Kabaja Pradeshaya. And there, if it is dyspnea is also there, that is also Kaba Pradeshaya. So if a person comes to you with all these Lakshanas, think of Kabha first and then treat it. Okay. Now, evaluation of rhinorrhea with purulent nasal discharge plus epistaxis. So, you can see it in Puya rectum. See, I have made a point that there is no previous history of rhinorrhea. Without a rhinorrhea, the person purulent nasal discharge will happen. You can see it in later sites. There is a disease for that. Okay. Then mucoid discharge plus epistaxis, it is Sannipata Pradeshaya. And purulent nasal discharge with Badhiryam. Again, so if you have hearing defects, smell defects, all this coming under the category of Dushta Pradeshaya. And you have a serosanguinous discharge with rhinorrhea, it is Rakta Pradeshaya. And Nasagada Rakta Pittam, that is only bleeding will be coming out without a discharge, that is Nasagada Rakta Pittam. Okay. Now recurrent rhinorrhea, that is based on chronicity. If it is acute, this has been already told, that is it is Vata, Pitta, Kapha or Rakta Pradeshaya if it is acute. If it is chronic or intermittent, it is Sannipataja or Dushta Pradeshaya. So, if a person comes to you like 15 years of history with recurrent, it is obviously we have reached a Sannipata Pradeshaya or Dushta Pradeshaya. Okay. This has been already told. Now, the cause of Dushta Pradeshaya, this is very important to know, because a Dushta Pradeshaya can manifest in two methods. One, that is, the disease has been come acutely. That is, you have a Pradeshaya Pururupa, Pradeshaya Vata, Pitta, Kapha. And the disease is so severe that the bacteria invades into it. So, a secondary bacterial which makes itself into a Dushta Pradeshaya. Okay, so acutely also you can get Dushta Pradeshaya because of the intensity of the disease. Second is that the disease is chronic, the person's immunity has come down, that is also Dushta Pradeshaya. So that is why you can see that there are two kinds of lakshanas that is being told in Dushta Pradeshaya. Initial stages, that is Puyopamasita Rakta Gradita Sleshma Samsruti has the first one, and recurrently Nasa Kleda Shosha, and that is being told in the second one. Okay, so both these comes under the Dushta Pradeshaya. Now we'll go with, are you being bored? Am I sure? Okay. So you can see this viral rhinitis. It is very common in clinical practice to get viral rhinitis. Okay. So you can see that there are three stages in viral rhinitis. You have virus, it is not immediately that you get white kabha the next day. If you have analyzed it, you can see that first there will be a burning sensation that is happening. Okay. There will be nasal congestion that will be happening. That day you will not have any discharge from the nose. So that is a stage of apinasa. That is the starting. Then the next day you can see that water is being coming out from the nose. That is sticky. When you just wipe it off, you can see that it is being stuck, sticking to the nose. Okay, so that is the second stage where you have an ama involvement into that. Vata Pitta Pradeshaya with ama. And the last stage where infection, secondary bacterial infection come into it, that is you have purulency that is coming from it, that is the Dushta Pradeshaya stage. Okay, so these three stages come into a viral rhinitis. Okay, if you start treating, why I told us this, because if you start treating at the early first and second stage, is very easy to treat. The disease will not go long. Or if you don't treat at the first two stage, you can see that viral rhinitis stays for more than 2 weeks and 3 weeks. It takes time to treat. Okay, so that is why it is coming under the Dushta Pradeshaya. Now the Brahmshatu, which I told you earlier, so you can see that Prabhrishyate Nasika Eva. See that there is difference between rhinitis and Prabhrishyam. Prabhrishyam means it is Adappadanam, that is it falls down. It comes out because it is excess. You can see that a yellow thick mucus indicates the cold, that is initial starting stage of the this rhinitis can be called as Brahmshatu. It's a very starting stage. That is why we told that after apinasa, there can be chances that if a person takes pitta predominant things, he can go to a stage of Brahmshatu, where the waterness will come, there is no ama, it is half cooked, that is Vidagda, that is why you have an yellowish color. Okay, that can happen. So apinasa can go a stage of Brahmshatu, or it can come after the stages of Pratishaya Purvaruva, Pratishaya, Dushta Pratishaya. Okay. That is why it is told. See, once yellow mucus has sets in and persists for many days, it could develop into rhinitis. So it could develop into a rhinitis stage. Management of flu. This is very important to know. Dr. Mitra had told that you can give soup, chicken soup, or those who don't want chicken soup, you can give a normal vegetable soup also. Put some tricatu in that, that's all. Okay. And do not prescribe any decongestant, because this is a very common practice that is happening. Whenever you have a acute rhinitis, already you will get oxymetazoline, that is what you can, Otrivin. That is what the normal practice is being. But don't do that. That does not have any result. It will go into a negative stage. Instead of that, what she told, Svedana, you can do that. You can ask the person to inhale. And in the apinasa stage, that is the first stage, the best treatment which I would say that is to take Tikshna Duma, that is Pradhamanasya. Because I told this because I am a practical example of that. Last day I took a Virechana because I had a Pitta predominance in my hand, whether it was severe burning sensation, I could not eat anything. With Avipati Churna, fortunately or unfortunately, I got nearly 25 Vegas. And by the end of the day, I was like, cramps started coming into my body. There was Vata Prakopa. And in Kerala right now, the season is that it is a very good harbor for viral conditions, because you have very hot climate, immediately you have cold showers and that. So this is a very good chance for a viral thing. I got cold, that is rhinitis that is being happening. Okay, I started with Tikshna Pradhamanasya. I did not do, I had a very simple method. What ma'am told is very good in a theatre if you can do, but in practical method, what I do is take a small bit of the churna and that, you close one nice, take it inside, just like the people who take the nasal thing. That also will happen as a Pradhamanasya. Instead of you pump with a pump, your nasal force itself is a pump. It goes inside. And you can see that it will drain out the kabha like anything, and you can spit it out. Your ears will open, your all things will get okay. Your nose block will go. That also you can do. I like, yesterday I asked a question. There is a Nasika Churna, which is, I think to my belief, it is only Kottakkal is being manufacturing that Nasika Churna. This is very good for doing Pradhamanasya. You take it, you inhale it, just in a sniff, the Churna will go into it, the kabha will decrease. Okay, so you can do it in that stage. You can do Pradhamanasya, Tikshnas in the very first stage. Okay. Chicken soup, all this can be given. Antibiotics has no role. That is very important to know. Antibiotics does not have any role. Okay. Now the bacterial, when bacteria invades into this, you have see the acute, the VRS has been changed into Dushtatam Prapya. That is, it has become Dushta Pratishaya. And you can see all kinds of all doshas, that is the Lakshanas that is being there. Okay. So you have a Dushta Pratishaya that is there. And now we can see the plain sinus X-ray. Everywhere initially we used to have Waters view for X-ray for doing PNS. Now we don't recommend X-rays. We go for CT. And very limitedly CT coronal section. That is very important. CT coronal PNS section. Okay. Here we go with Katu Tikta Dravyas, that is Nimbasava, that is Katu Tikta Dravya, Nimbasava, Vyoshadi Vadaka, that is all the treatment word. And sometimes if it is not, if the patient is cachexic, we do refer and then we do treatment. Now apinasam, this is very important, we have a critical review on that. See, you can see Anahyate, that is there is a nasal block. You have a Vidupyate, that is burning sensation. You have a praklidya. It's only praklidya that it is told. There is nothing told as the water will come down. Okay, so there is a nasal stuffiness here. And there is naveti yo gandamsha. Here there is not anosmia, it is hyposmia. That is the person cannot take smell. Okay, there is a hyposmia that is happening. And pratishyaya samana lingam. So except the other, the running of the nose, all lakshanas of pratishyaya will be coming there. And if you see the Ashtanga Hridaya, he has described some more kabha pravriddhi in that. Kabho pravriddaha nasayam rudva srotamsya pinasam. So some more greater kabha predominant stage of this earlier condition is being described here. So it basically denotes the starting stage. Why? Because you see the treatment of apinasa. What is being told in treatment of apinasa? Kabha pinasavat kuryad apinasayoho. So if apinasa was the end stage of the treatment, he would not have told, okay, you do it only with kabha pinasa. So it is only a starting stage, that of this one. Okay. And again here you have two things, that is in Apinasa there are two treatments. If you see Susruta, that is a Tishna local treatment, and Snehana Sweda Vamana. So you can say that Apinasa, if it is on the first stage, that is starting stage, you do only on a local treatment. If it is recurring, that is happening, then you can go for Snehana Sweda. Because someone had asked why Snehapana is there. Snehapana is always given in a case of Sannipata Pratishaya, not in a cases of acute ones. Okay. Okay, I'll just skip off with this because it's Dushta Pratishaya. It is again, you have all these Lakshanas that is mentioned here, so it is coming under Dushta Pratishaya. Then you have a chronic rhinosinusitis. Again, we said if it is chronic, you can go either with Kapha Pratishaya if the Lakshana is only white, or if you have all other Lakshanas, it is Dushta Pratishaya. Non-allergic rhinitis with eosinophilia syndrome, NARES, something there. Okay, so here only we have eosinophilia. So here you have negative allergy test. All the allergies will be negative. CSF rhinorrhea, nasal, because we hardly get CSF rhinorrhea. In my clinical practice, I have hardly met only one case when we are doing with PG, because all the time a fracture happens, person will directly go to the allopathic hospital. So CNF rhinorrhea, you don't get it. Okay. Even if you feel that watery nasal discharge that is coming there without any history of rhinitis, just ask for beta-2 transferrin. There is beta-2 transferrin to be tested. That is the diagnostic point for seeing whether it is a CSF rhinorrhea or not. Okay. If beta-2 transferrin is present, it is a CNS rhinorrhea. Okay. Now, Nasa Sravam. Now, there is something, this is very important. You have something non-traumatic CSF rhinorrhea. Every time CSF rhinorrhea is told as traumatic. Okay. You have something called as non-traumatic CNS rhinorrhea, where without any cause, the person has nasal discharge. This is the case that had come to our OPD when we were doing PG. The person, you know how he has come, he told like, sir, water is coming from our nose. So we just asked, can you just show? He just bent like this, water was coming like open from a tap. This is that was the case presentation that was happened. Okay, so you can get patients like this also. You should remember that there is something called as non-traumatic CSF rhinorrhea. Okay, that is what you can see, Ajasram Macham Salilam Pragasham. Okay, it keeps on coming like white clear discharge that is happening. Okay. Now I do not know explanation of Ratro Visheshana, why that is being told. That is being told. We are not got an explanation of that. And you can see that this is correct, because see, in here there is it is being explained that there is a bony defect, and that is why you can see in the treatment while Susruta has told there is Chaga Mamsa, that is Mamsa Rasa has been told to be given in this. But in Susruta, but in Ashtangradaya, a reverse is being told that is you have to start with the Tikshna Nasya. So Tikshna Nasya initially, then you have to go for a Brahmana treatment. That is what it is told. Fungal sinusitis, it is, even though it is explained, you can read this, it's very difficult to treat, because fungus is such a thing that the moment you touch it, it's like it becomes the Sarva Bhagavan, everything will, every hand of it will come out. So if it is better, if you are confident, if you have all the, not confident, if you have all the emergency management in hand with you, you can touch it. Else better to refer the patient. Okay, the fungal sinusitis. In this you can see the Puya Rakta, that is what I told. In here in fungal sinusitis, you can see the patient usually maintains an effective immune system. He does not, he may have an experienced trauma or injury. Nijayad abhighadadva puyasrik sravet. Okay, so there can be an injury to this, and there is no inflammatory response, so only the discharge will come out. It is not a pratishyaya. Okay, it's only discussed as puya raktam. Hypertrophic rhinitis, it is kabha vata pratishyaya. Okay, it is kabha vata pratishyaya, hypertrophic rhinitis. And all this is dushi, which I already explained earlier, drug induced rhinitis, rhinitis medicamentosa, and honeymoon rhinitis, that is also being told, emotional rhinitis, hormone related rhinitis. Rhinitis caseosa is also very rare, you don't get it. Again, since based upon the discharge size, we call it as nature, we call it as dushta pratishyaya. Rhinolith calculus, this also I have not met till date any cases in my OPD. So again, it is because it is Gradis Leshma, we have taken it into the dushta pratishyaya category. Okay. Maggots of nose, we have got maggots of eyes. A old lady, when we are doing in PG from a very interior of a village, she had come with a mass on the eyes. I don't have photos in this, or I would have shown. So a mass was there. we just try to see the mass, what was there under the mass. We could see, you can see this picture, right? See here you can see maggots. This we had seen, but it was in ice. Okay, and we had put turpentine to that, all maggots started coming out. We had nearly removed around 500 to 600 maggots from there. So you can get into the nose also. This is all seen in very interior places where people don't maintain hygiene, because that is the first thing you can see. Poor hygiene is an important contributory factor. Okay. And even in these conditions, it's better to refer the patient initially. Once after removal of the maggots, then you can start our treatment according to the dosha. Okay. Now, evaluation of sneezing. This is a bit controversy, I feel.